Welcome. I'm Meg, and I'm one of the founders at the Center for Collaborative Medicine, and today I want to share with you my knowledge about the patterns that arise from what I call the blood sugar quartet, or the blood glucose quartet. Patterns tell us the story behind the tests and help us understand how to truly treat the results. The goal of today's talk is to discuss the 4 basic tests in this quartet, most of which many of you have likely already had tested. Knowing your patterns can lead to habits that can change the course of our health and mitigate the risks of health conditions such as diabetes, Alzheimer's, and even hormonal imbalances. I also want to make sure I give you practical advice in the form of 3 key things that you can do to optimize these markers. Unfortunately, most of us don't think that a chronic disease is going to happen to us, or if it does, that we can just take a pill and all will be fine. The reality is that 1 out of 3 of us are going to have a problem with blood sugar in the form of diabetes or prediabetes, and up to 20% of us won't even have that stereotypical appearance that is associated with these conditions. Now, although pills can help, chronic blood sugar problems still have risks, such as amputation, blindness, heart disease, and even Alzheimer's. Unlike diabetes, we don't have a pill to stop the progression of Alzheimer's, but we do know that Alzheimer's is insidious, and the process starts about 20 years or more before it is diagnosed. Thus, if this disease on average hits people in their 60s or 70s, we can start steps to prevent it in our 40s. In our current model of medicine, we focus on high blood sugar levels or high blood glucose levels. However, this model is akin to putting the cart before the horse. We should be looking for insulin resistance. It's important to know the biology that leads to this disease process in order to truly address high blood sugar problems. In most patients, high insulin actually precedes insulin resistance, and which then precedes high glucose levels. But unfortunately, the dotted line is where mainstream medicine starts when evaluating these conditions. At that line, we're missing the full picture. We're not checking insulin, and what we need to be doing is looking for high insulin and insulin resistance, because high insulin typically starts before we see these blood sugar changes. Now, this bigger picture is going to include things like a fasting insulin and a closer look at triglycerides. And this pattern applies to almost anyone, but I wouldn't apply this to anybody who's taking insulin right now or is on a medication to lower triglycerides, since those medications can alter these results. So before I continue, let me just give a brief explanation of each marker. So hemoglobin A1C is a percentage. It looks at the 3-month average of our blood sugar levels. An optimal level is under 5.4%. A pre-diabetic level is going to be between 5.7 and 6.4%, and then a diagnosis of diabetes occurs at 6.5% and beyond. For glucose, I will be referencing this as sugar throughout this presentation. The fasting glucose is what we are evaluating, but these markers will not tell us how high blood sugar is going after somebody eats or drinks. Insulin, which I referenced earlier, is a hormone that controls where sugar goes. Specifically, I want to know a fasting insulin level, and studies show that the optimal level is under 7. The best analogy for insulin is to see it as a key that unlocks the door to our cells. Without this key, we can't survive. It allows our cells to eat and make energy. Although we need it to survive, in excess, it starts to prefer to feed fat cells, which causes weight gain, hormone problems, liver damage, low energy, and more. I call it the fat fertilizer. And then finally, triglycerides, which are usually only focused on when we are looking at cholesterol levels. These are actually something I include because they are one of the primary causes of the primary cause of high triglycerides is actually excess sugar and carbohydrate intake. And then these high triglycerides also increase the risk for liver disease, which unfortunately we're seeing more of in children. It's not a disease, it's not a dietary fat or cholesterol issue, even though most of the foods that have high fat or cholesterol are also high in sugar and carbs. So together these make up what I call the blood sugar or the blood glucose quartet. So let's get to the nitty-gritty and look at some examples. So first, an example of what would look like a normal test. I see this often, especially in my patients that have problems with weight gain. In mainstream medicine, a result like this will lead to the recommendation of eat less and exercise more if weight is that primary concern. Unfortunately, if you look at the bigger picture, this can give us more guidance. In this case, high insulin and high triglycerides tell me that this patient isn't good at metabolizing starches and sugars. A patient with results like this is walking the path towards diabetes and Alzheimer's. For this, it could develop over the next few months, or it could take 5 to 10 years to develop. So the first step in someone with this pattern is to address nutrition. Insulin goes up when sugar and carbs are consumed. So to lower insulin, we need to lower the intake of these type of foods. Now, I go by the World Health Organization's recommendation of eating less than 25 grams of added sugar per day. In our modern culture, most of us actually consume about 100 grams or more per day, and the average American consumes 300 grams per day. That's a huge difference. Obviously, there is a spectrum of foods that have sugar and carbohydrates in it, so in the long run, education is truly what's needed to be aware of these sources, but for now, we can look at nutrition labels. And for example, this nutrition label is off of skim milk. And although this is a naturally occurring sugar, in somebody with high insulin and blood sugar problems, the sugar found in this skim milk, for example, can perpetuate a blood sugar imbalance and cause all those damages that I mentioned before. All right, so let's look at another example. So in this example, the results line up with a diagnosis of diabetes. Both the hemoglobin A1C and the glucose are in a diabetic range. At this point, medication would be added or adjusted, and a patient would be sent home, again with that recommendation to eat less and exercise more. But if we get the bigger picture, this is where evaluating patterns is essential. So a normal insulin and near normal triglyceride levels in a patient with abnormal diabetic markers tells me that the pancreas, which makes insulin, is failing. This, in the story that unfolds, tells us a few things. So first, the pancreas is still making insulin, but the insulin isn't doing a great job at keeping the blood sugar levels down. We don't know how much time we have until the pancreas eventually can't keep up and eventually stops making insulin or dies. And I don't say die as in truly dies, but that the function, the endocrine function of the pancreas basically stops working. So the patient may have a few months left, or they may have a few years, but this is a situation where the potential to be improved is still there, and it can even be reversed if these are addressed immediately. If not, the patient will likely have to start taking insulin injections to keep their blood sugar levels down. And not many people like the idea of having to inject themselves. And on top of that, insulin is inconvenient, it's costly, and it increases the risk of other health problems. Thus, this patient needs to make changes in their daily habits and lifestyle immediately. I would aim to get their sugar intake under about 15 grams of sugar per day, focus on a higher protein Mediterranean style diet, which has been tested over and over again in literature, and we know it works, and then working with a health coach or nutritionist for accountability. These changes aren't convenient, so no pill is going to really help, but they do require an investment of time and money. However, the costs are minimal when compared to what the average patient with diabetes will end up paying every year to control their condition. So, according to the American Diabetes Association, which this was released in 2017, the cost averages more than $13,000 per year per person with diabetes. That's a lot of money. So, moving on to another example. Here we see something that looks like they have prediabetes, according to their hemoglobin A1C levels. But the pattern of glucose is not mimicking that hemoglobin A1C level. I would expect the glucose to be between 100 and 125. But since that pattern isn't matching up, I need to see the insulin and triglyceride levels. So this, of course, is going to add more confusion because the insulin and the triglycerides look great. And many of the patients I see with these patterns typically have a problem with energy levels and only an abnormal hemoglobin A1C. So in this case, I wouldn't treat this patient as if they have a blood sugar problem. And many of my colleagues, unfortunately, would put a patient with this pattern on a drug called metformin, which is relatively benign, but it has unpleasant gastrointestinal side effects. So in this case, the first thing I'd actually look for is do some more testing for anemia. Specifically, the first step in iron deficiency anemia, which is a ferritin level. When this is under 40, it's associated with anemia-like symptoms and that abnormal hemoglobin A1C. I'd also recommend a test called the glucose tolerance test, which most healthcare practitioners don't order unless somebody is pregnant. And the main reason they don't order is because of inconvenience, and patients aren't as likely to follow through with the test since it does take a few hours to perform. So the test is a good way, the glucose tolerance test is a good way of looking at how the body is responding to sugar over a 2-hour period of time. And I actually want to know 3 specific values. I want to know the value before taking the sugary drink, I want to know the value at 1 hour after the drink, and I want to know the value at 2 hours after taking that drink. I would expect to see high sugar levels at 1 hour, but I don't want this value to be over 140. And by the time we check a 2-hour value, I should start to see those sugar levels plateau or even drop down. The chart on this slide is what I actually use to evaluate these results for individuals, and I tend to like to draw in the results for each patient and write them in. I think it's a little bit more personalized by doing it this way. So let's just touch on one more example, which is going to be even more complex, but this one is looking at what looks like a clear-cut pattern of prediabetes. So hemoglobin A1C is between 5.7 and 6.4%, which is pre-diabetic levels, and glucose is between 100 and 124. But when we look at insulin and the triglycerides, these actually look good, and I'd expect to see higher insulin and triglyceride levels in somebody with a pre-diabetic process. In somebody with this pattern, I will still address nutrition, but the more common causes of this is actually a rise in the hormone known as cortisol. Now, cortisol is released when we are under stress, and it tells the body to release sugar from storage areas, since stress requires energy and sugar is energy. This is a good process, but if the stress is chronic, the body needs to store more and more sugar to prepare for that cortisol release. And like I mentioned earlier, fat cells end up becoming that place where sugar gets stored and actually leads to weight gain. So stress can cause weight gain as well. It's actually a lot more complex than this, but for simplicity's sake, stress leads to a release of cortisol, which leads to a release of glucose, which then can lead to that appearance of abnormal glucose levels on labs. In somebody with this pattern, identifying and addressing stressors is very important and essential, and I will still address nutrition, but they don't fit the typical pattern of blood sugar problems. And so even though those sugar levels aren't really high, they're still going to put that person at risk for complications that are associated with those higher than normal blood sugar levels. Now, of course, we all experience stress and it's unavoidable, but the best way to help our bodies deal with stress is to develop a daily form of relaxation. Unfortunately, most people relax in front of electronics, but relaxation should not involve electronics since these actually cause stress on our eyes and our brain, and we're trying to eliminate stress, right? So, in summary, our medical system is missing the full picture by just checking that hemoglobin A1C and glucose. To truly prevent and reverse chronic metabolic imbalances, we need to go upstream. If we can identify hyperinsulinemia and insulin resistance before disease is diagnosed, we may be able to stop that destructive process of diabetes and even Alzheimer's. As in any chronic disease, these changes actually start to occur years before diagnosis. And thus, we really should be including these 4 tests, in our yearly physicals. And as you saw in today's presentation, these tests create patterns that we can interpret into stories to describe that underlying biology. Now, since 1 in 3 people have metabolic imbalances, as I discussed earlier, the chances are high that you or someone you care about needs to be evaluated. With these 3 steps on the slide, anyone can address and decrease the risks of developing disease. And the side effects of implementing these are going to be things like weight loss, improved energy, and even better hormone function. So first, people need to know their numbers and look at these yearly. Knowledge is a powerful motivator. Second, make sure you're eating at least 25, or you're eating less than 25 grams of sugar per day, or even go for that optimal of consuming less than 15 grams per day. And third, take stress seriously, because stress really is one of the leading causes of chronic disease and death. Now, as a caveat, give grace to your healthcare provider if they won't order that fasting insulin, because the tests I mentioned today, of the 4 of them, 3 of them are likely already standardized and already checked. But there is no drug to treat a high insulin value, and if your provider isn't well versed in lifestyle education, they can actually put their license at risk if they don't know how to treat an abnormal insulin level. So a licensed functional medicine practitioner can order these and interpret them. But of course, for patients who want to just start with the labs, there are out-of-pocket options that can be purchased without a practitioner's order. So an example of this is a direct-to-consumer testing site such as yourlabwork.com. So, of course, if you'd like my help, please reach out to me at the Center for Collaborative Medicine. And I thank you for your time in watching this, and I really hope it was informative and helpful. Now, although we focused on test results, the best care a patient can receive is from a professional that knows that tests are not perfect. Overzealous testing, unfortunately, is common in the functional medicine model, and it costs a lot of money. But patients and practitioners always have to remember that everyone is unique, and we don't always need a test to treat a patient that's suffering. So, thank you again, and if you need me, just reach out to me at www.collaborativemed.com. I wish you all great health, happiness, and life at ease.